Hello and welcome to another episode of our three-part series on the miracle weight loss medication everyone is talking about. I'm Zachary Rios, your go-to guide for all things health and wellness. I'm an adult gerontology primary care and addiction treatment nurse practitioner practicing right here in New Jersey and Pennsylvania. In our last episode, we kicked things off with Zepbound. If you missed it, go check it out. Today we're diving into part 2 of this series, and you guessed it, we're talking Ozempic. Before we get started, don't forget to like, follow, and share if you're enjoying these episodes. It helps more people get the info they need to make empowered decisions. And a quick shout out to today's sponsor, Rios Enterprise, empowering patients with the care they deserve. All right, let's get into it. Today we're going to be discussing what Ozempic is used for, how you use it, the doses for Ozempic, who Ozempic is for, side effects that you should look out for, as well as insurance costs and some reality checks. So without further ado, let's dive right into it. Ozempic is more than just a buzzword on social media. It's the brand name for a medication called semaglutide, and it belongs to a class of meds called a GLP-1 receptor agonist. I know that sounds super technical, but here's the simple version. GLP-1 is a hormone that's naturally made in the body and regulates your blood sugar. It tells your brain you're full and slows down how fast your stomach empties the food. Semaglutide mimics this hormone, giving your body a little boost to help lower blood sugar and reduce appetite. It's like your pancreas and your brain had a productivity meeting and decided to work smarter, not harder. Who doesn't love that? Now, let's talk about how you actually take this thing. Just like Zepbound, Ozempic is a once-a-week injection, just little shot once a week every 7 days. It comes in a pen, and you can inject it under your skin, usually into the belly, the thigh, or the upper arm. You can do it yourself at home, and it's pretty easy, user-friendly, and once you get a hang of it, you won't even realize that you're giving yourself a shot once a week. Just make sure you rotate those sites so that you avoid any irritation. Just like Zepbound, with Ozempic, you want to start low and slow. You don't start at high doses right out the gate. Your body needs to adjust to these doses to help reduce any efforts of nausea, vomiting, diarrhea, things of that nature. And here's a breakdown on the dosing guide. To start, for the first 4 weeks, you'll be on 0.25 milligrams. Then you can go up to 0.5 milligrams. If needed, you can increase to 1 milligram and even 2 milligrams depending on how you're doing with blood sugar and weight loss goals. Remember, low and slow, not only does it keep you happy, but it also keeps those side effects down. Who's Ozempic for? Originally, when it was FDA approved, Ozempic was approved to treat strictly type 2 diabetes, and it's really effective at lowering your blood sugar levels. It's also great at reducing the risk of cardiovascular events like heart attacks in people with diabetes. But here's the twist that they found when they started giving people Ozempic. Doctors started noticing weight loss as a pretty big side effect, and one that many patients were not complaining about. That led to the development of Wegovy, which is a semaglutide, but approved specifically for chronic weight management. So yes, if you've heard of people using Ozempic just for weight loss, they might be using it off-label, meaning it's not officially FDA approved for that use, but it is prescribed anyway. Remember that it does have a direct effect on your blood sugar, so you need to be monitoring for some of those signs and symptoms of low blood sugar. Cold, clammy, things of that nature. So, let's talk side effects, or turbulence, because no one likes that. Real talk, Ozempic can work wonders, but it can also make your stomach do jumping jacks, or flips, whichever one you prefer. The most common side effects. Nausea. This one's not too bad, especially if you're losing weight. Some people let it go by the wayside. Vomiting, that's when problems start to occur. Diarrhea or constipation. Some fatigue due to the blood sugar decreasing. Bloating, burping, and of course, decrease in appetite. But who's really complaining about that one? Now, one more serious side effect. Some people can develop pancreatitis, and while it is very rare, it's no joke. If you even get severe persistent stomach pain just once, especially radiating to your back, you need to go get that checked out very fast. The one that everyone I'm sure has been waiting for. What's that number on your wallet going to be? So Ozempic can cost over $1,000 per month without insurance. Yes, that's right, $1,000 a month. But if you have type 2 diabetes, that's never good news, but for Ozempic, that's good news because most commercial insurance plans and Medicare Part D will cover it. If you're using it off-label for weight loss, things get a little dicey there. Insurances may not cover it unless you meet strict criteria, like having certain BMI and related health conditions or comorbidities. Also, check out the Novo Nordisk savings card. It can help reduce costs if you qualify. Now pay attention because there is a black box warning. This part isn't fun, but it's important. Ozempic comes with an FDA black box warning: thyroid C-cell tumors, including a rare type called medullary thyroid carcinoma. So if you or someone in your family has a history of medullary thyroid cancer or a condition called MEN2, multiple endocrine neoplasia syndrome type 2, Ozempic is a no-go for you. Watch out for symptoms like a lump in the neck, hoarseness, trouble swallowing, and let your provider know if they pop up as soon as they do. Now, is Ozempic right for you? So, is Ozempic a miracle drug? For some, yeah, it kind of is. It can dramatically improve blood sugars, help with weight loss, and even protect your heart. But remember, it's not a quick fix or a replacement for lifestyle changes. It works when combined with a healthy diet, regular movement, good sleep, and a strong support system, including your healthcare team like your primary care or your endocrinologist. Talk to your provider. Don't just follow the trends. Your health journey is unique, and so is the right plan for you. With that being said, that's a wrap on today's deep dive into Ozempic, part 2 of our 3-part series on weight loss medications. If you're enjoying these episodes, hit that like, follow, and share button and help us spread the word on safe, informed healthcare. Next time, we'll be wrapping things up on this 3-part series, so stay tuned. I'm Zachary Rios, and this has been the Miracle Med series brought to you by Rios Enterprise, empowering patients with the care they deserve. Stay curious, and I'll see you on next episode.